The pelvic structures in male and female are different. As compared to pelvis, female pelvis is larger, broader, and shallower. The iliac crust lies higher in male, which makes male pelvis narrower and deeper. You can understand. So the pelvic cavity will be more deeper pelvic cavity. And while in female, iliac crust lies lower, which makes female pelvis more shorter and broader. Male has a long straight pubic symphysis with 70-degree angle with hip bones, while female has a shorter pubic symphysis with a broad angle between 90 to 100 degrees. If you talk about the sacrum of a male is more long, narrow, straight, and less movable, while female sacrum is short, broad, with more mobility. And that mobility and the whole pelvic region is gonna depend upon which hormone, which phase of a life female is going through, which hormones are there. And relaxing is always gonna create some kind of relaxation, broadening, widening, more widening into female body during the pregnancy. Third trimester, when baby is going to move downwards, we need a space inside, and body is going to create a space by widening this area. So all these structures makes male inlet looks like heart shape and narrow, while female inlets look like round and oval shape. Another thing which is important to understand is the ligaments. There are 4 important ligaments present here, and one ligament which we already discussed. So that is this pubic ligament or red color. So we have different colors here. So one is this pubic ligament, which is connecting these both pubic bones together. And then from right tubercle or left tubercle, if you palpate that, from there to ASIS, we have another ligament. We are calling it as the ilioinguinal ligament in green color. If you rotate the sacrum back, we have posterior side, the yellow part, from the sacrum to the sacral ischial spine. We have another ligament coming, and that yellow colored part is a sacrospinous ligament. And we all know about SI joint. We have a SI, sacroiliac ligament present there posteriorly. So altogether, anteriorly pubic ligament, on again anteriorly around the abdomen, we are having ilioinguinal ligament. There are 2 ligaments present posterior. One is two SI posterior sacroiliac ligament, and 2 sacrospinous ligaments in yellow. So these are the 4 ligaments which is present. And these ligaments are very, very important to maintain the pelvic stability actually, or the alignment of the pelvis. So if we understand, if sacrospinous ligament, posterior ligament, if that is tight, so if there's something happened to this ligament and tightness build, so the tightness is going to create a posterior tilting into the pelvic bone. And if there will something happen to the ilioinguinal ligament, some kind of adhesions around those area, the muscles which is coming, the fascia which is attached around this area, or the organs which is coming into contact, if something, some inflammation, some adhesion, some scarring, which is very common after some surgeries, abdominal surgeries. So that can create tightening into this ilioinguinal ligament. And if that ligament is tight, it will give female anterior pelvic tilt. And during the pregnancy also, we can see that anterior pelvic, this ilioinguinal ligament will go for kind of too much of strain. And because uterus is going to put a lot of straining over that, and lordosis is also present there. So there will be more tightening around this area, and more laxity will be there on the posterior side. So that can give anterior tilt. That can be one component which can give anterior tilt to the female. And same way, the sacroiliac joint is also very, very important, that to maintain the alignment, midline alignment. We don't want asymmetry in our PSIS. So that asymmetry can be noticed if one side of the SI joint is weak and one side of SI joint is strained or tight. And so it is important to understand that the tightness of that can cause the problem with the alignment of the pelvis and tilting of the pelvis, right tilting, left tilting, anterior tilting, posterior tilting. Okay, so we should always keep that in our mind. And if the female is acquiring that position, so what can be the reason, which ligament might be going under the tension, and what can be the history of the patient which is causing the tightness into that ligament. We will always try to think into this way. Okay, so don't forget, always look for the bone and bone, like the palpation of the bone. And the second is the alignments of your hip is very, very important. And if alignment of the hip is like it's misalignment, malalignment is there, so try to correlate why, which side she's having malalignment and what can be the causative factor of that. And when might be the adhesions and attentions, what can be the cause of it. So we will always try to understand. So we were talking about our this pelvic bone, and just this is the bone. We don't have, this is a sacrum which is movable, this is the pubic symphysis, this is the ilium. We understand that. We can palpate our sits bone, ischial tuberosity, we can palpate our coccyx, we can palpate our pubic symphysis. So anteriorly pubic, posteriorly coccyx, sacrum, and both sides we have ischial spine, ischial tuberosity outside and ischial spine. When we are doing the transvaginal transrectal examination, then you can also palpate the ischial spine. So this is our bone, and the bone is having a floor. So this is a bone, and then let me attach muscles here. So we have these muscles, which is the pelvic floor muscles, and into these pelvic floor muscles we have a pelvic organs. So we discuss that with ligaments and the arch and like shape, everything. I think we understood. Now, if the female is in front of us anteriorly, so we have to understand the whole area, whole compartment. We know the abdominal region, we know the posterior back muscles, back support, back region, we know the diaphragm, we know the pelvic floor, and now let's understand what is present here, this particular part. So once the female is standing in front of us and she's lying in front of us, or might be we are gonna help her with our physiotherapy or with our pelvic rehab. So the first thing which we are always gonna see externally is the vulva of a female. Not only the vulva, pubic symphysis, and then the vulva. And then we'll slowly we'll try to, into the vulva, we will have a vestibule. Into the vestibule, we'll see the urethral opening, vaginal opening. So there's a vagina inside, urethra also inside. So after crossing the vagina, there will be internal reproductive organs internally. So all organs are also present. So let's start our topic, VulvoVaginal health, and understand what lies down there when the female will be in front of us. Vulvovaginal health, understanding of our very, very important structure and the right care into that structure, or because if you don't understand, you will not be able to advise her, guide her, and whatever things are lying into this panty, a lot of myths are also into the society and into the world. So let's understand the female, this particular important structure, vulvovaginal health. It's very important. And as a physiotherapist, we can do a lot of things around this area whenever changes and damage happens. Pain is there, laxity is there, weakness is there. During pregnancy, there might be pubic ligament pain. So we understand the pubic region present here. So pubic ligament pain, round ligament pain is there. There might be pubic symphysis pain. There might be vulvodynia. There might be vestibulitis. There might be some issues with the pelvic floor and tightness of the pelvic floor, weakness of the pelvic floor, urine leakage. Everything is into this particular region. So and we have a lot of devices, modalities which we can apply here, like ultrasound, TENS, cryotherapy, IRR, IFT, and you just name any device, we all can apply into this area also. So let's understand that area first. I'm so sorry if this image is a bit offensive, but very important. We have to understand the female. So this is what we can see. The female is in a crook-line position with hip abducted hip. And when she lie in front of us, we can see that always a hair covering. And we call that pubic hair. So we have a pubic hair present, and into the pubic hair, then we are having pubic symphysis is covered by one layer of the fat. In that fat layer, we have small glands present, and the fat layer is also having a covering of, you can see, one subcutaneous tissue. And on the top of the subcutaneous tissue, we are having hair, skin present. And on the top of the skin, we can see the hair present. So all this part is called mons pubis part. And on the side, we have two labia majora present, one on the side and one on the other side. So assume that we have the face down there. So in this face, we have these two cheeks present. And then if you open up the labia majora, there's another two flap of the skin, which is present. That's the labia minora. So let's understand one by one these structures. And we have a perineal body also, external anal canal, external anal canal also present. So let's understand all this thing. Understanding of female reproductive system and external genitals are very, very important. As a women health physiotherapist and women health care provider, we should be able to understand mons pubis, pubic hair, labia majora, minora, vulva, vestibule, clitoris, vaginal opening, what is hymen, what is vagina. So the first part is mons pubis and pubic hair. So when the female is, assume the female is in a standing position, okay, after removing the her panty. So then we can see this triangular shape, okay, the pubic bone is covered by this triangular shape of the skin. This is the area which we are calling it as a mons. Some females can, you can see the mons is more protruded mons, and some females can see, show you flattening into that, flattened mons. So the protruded mons will be visible in the female who are thin, who don't have a fat around the thighs, around the abdomen, lower abdomen. The fat is less. So in this case, the bone will be more palpable bone. And because of the palpable bone, the protrusion will be seen into the pubis of the female. And when the fat layer is present, we can see that protrusion is not present. So all your female can show you different structures there. A very, very important thing that we can guide our female when they have less amount of fat present. It means the supportive structures are less. So those females can always develop some kind of pain around this region and more susceptible to develop the round ligament pain or pubic symphysis pain. So if they will do activities which is gonna directly touch the mons pubis, so like horse riding, bicycle riding, or the female is doing, you can see, any riding of this, any direct touch on the seat. So the direct touch can always irritate the structures and can give some kind of pain to the female. And the female who is having a enough fat level, so their structures will be more protected. So as per looking at that structure, if your female is asking you that, ma'am, I'm having a pain and a lot of time I'm having this kind of issues, painful issues. So we can understand that why she's more prone to have those issues by looking at the mons of a female. Protrusion might be more touching, external touch can always damage the pubic symphysis also. So accidental heat damage can always be more into the protruded mons. The mons is made up of fatty tissue. So fatty tissue is a very, very important part here. So fat layer is present, extends from pubic bone to the clitoral hood. If you, please mute yourself. If you understand, we have one important organ here, clitoral hood. So I want all of you, if possible, tonight you see your structures into the mirror and try to understand your mons pubis and your structures. So starting from this pubic bone, the bone which we are palpating, and go all the way up to the clitoral hood down there. We have a clitoral hood. In this image, you can see clitoral hood is present here. Okay, so this is a clitoral hood. So all this way from here to here, clitoral hood, the skin is present and this area is there. So we are calling this area as the mons. So mons is made up with the fatty tissue, extends from pubic bone to the clitoral hood. And this fatty tissue, which is present here, they have many small glands, sweat glands actually. And these sweat glands, like our sweat glands are keep secreting some kind of sweating throughout the day. So these glands are also keep secreting the sweating throughout the day. So it means some kind of lubrication is always coming from secretion is always going on into these glands. So they create secretion. And in the in the skin which is present here, we have a pores. And through these small, minute pores, the secretion will keep coming outside. And we can feel lubrication into this area. That lubrication it's not like too much of lubrication, but some kind of moisture is always present in that area. That's why we don't feel dryness because of those particular sweat glands which are present there under the skin. And mons is completely covered by pubic hair. And the pubic hair which present here, they also has one important purpose, like nowadays what we do, we always keep plucking the hair, we remove our hair, but hair has a function actually. Pubic hair which is present here, so that is gonna provide, the first thing is gonna provide a cushion. So whatever thirst is coming from outside, this cushion is gonna support your pubic symphysis. The thirst will not transfer internally and damage your pubic symphysis. So that is the first function, providing the cushioning and making your pubic symphysis more secure. The second function is through this particular hair, like each hair which is present here, that has a hair follicle, and that hair follicle is going inside into underneath skin where our subcutaneous tissues are present, and into that particular area we have like many nerve endings. So from our body, the nerves which is coming throughout throughout the body, they are going to end into this region. And now each hair has a nerve ending. So assume that you have a 1,000 hair. So that 1,000 hair is gonna touch with the nerve ending. So this nerve ending is gonna make your pubic hair more sensitive to touch. If you touch your hair on your head and if you touch your hair on pubic symphysis, you can always see the difference. You can always feel the difference into the sensations. So more sensations are present down there, and each hair has a hair follicle, and that hair follicle is attached with the nerve ending. So that is going to make you more sensitive to touch. And during sexual activity, that is going to give you some kind of different sensation also. So that has a purpose. And another purpose which this hair is that each hair has a hair follicle, and this hair follicle is gonna attach with the and underneath apocrine glands. So through these particular openings, all the small openings, the hair follicles are coming out. The glands are gonna secrete the liquid outside. So we can bring the liquid outside from those pores into the skin. So very important they are. So they act as a mechanical barrier. And the second thing is they keep our skin more soft and provide a lot of moisture in the area. Now the fashion is that we remove our pubic hair with the wax, or we do waxing or we do plucking. So I can, you can appreciate this thing that whenever we are doing sometimes the plucking of the hair or we are doing the waxing of the hair, so sometimes we see that some kind of irritation or some kind of boils, pustules into that particular part after 2 or 3 days. So why the boils and pustules happens? So assume the hair, when you're plucking the hair, you're doing the waxing, hair is plucked out with the hair follicle. So hair follicle is also coming out. So that is going to leave some microscopical openings left behind. And that microscopical skin pores is going to come in contact with the external surface area of your panties. So whatever small particles are present in our clothes, so that particles are gonna block those small openings. And because of this blockage, now whatever secretion should keep coming outside through these open pores, but now the pores are blocked with this small, you can say that clothing, small particles or some bacteria, or might be the bacteria which is lying down into this region. So they might block that, they might obstruct that. And if that opening will be obstruct, but internally the glands will keep secreting, but the secretion will not be able to come outside, and it will keep collecting inside. And that can show us that kind of boils. And another thing, the pustules, and another thing which we can observe is, if the secretion will not come out, lubrication will be less. And if the lubrication will be less, we can see the itching into that area, lot of itching. And so the what I suggest and what I believe, that we should not pluck the hair, and we should try to avoid the waxing. But another important thing is that for some females, waxing is important part, because there are cluster of hair, and the hair shape is like a curly hair is also present in this area. And we have lot of liquids, we have lot of secretions are coming out, like we are going for urination, we have a vaginal secretion, we might have secretions coming during the periods. So sometimes all this secretion can, all accumulate into the area and entangle into those hairs. So that might be, again, another source of infections. So it's better to have minimum hair into this area if you don't want that. Otherwise, I always suggest that keep washing yourself. So that is the best thing, that keep washing yourself. And or you can minimize the hair by trimming. Try to avoid the waxing. And if the female is, this is what we should understand as a women health therapist. So, but if your female is asking you that, ma'am, I have itching and I'm I have too much of dryness into this area. So then we can give this guidelines, this understanding to them, that why the itching and dryness is present into her mons pubis, and what can be the solution. If we are having waxing, or the female is going for removing of the hair, it's always best to have steaming, vaginal steaming into this area for continuously 1 or 2 days till the time the new hair growth is going on. This, if you keep doing the vaginal steaming, it will keep helping in opening up the pores. And keep washing with the normal water, simple water. Frequent wash is also very important. So frequent wash, and the second is taking the steam, is always going to help the female if she is going for the vaccine. Okay, so that can prevent unnecessarily the blocking of the pores. And another thing, it is a good way of increasing the blood supply into that area. So glands will also, because the blood supply will be high around the small apocrine glands, so their secretion will always good. So the female can get back the moisture, and she can prevent the dryness. So this is what we can suggest our female to keep her bones healthy. Any question, girls?
Hello, ma'am.
Yeah, hi.
I have been wondering this question. Why is it that I've noticed this since pubic hair is always more thicker than the remaining hair of the part of the body?
Yes.
I noticed since.
So what is the reason behind that? You want to ask that? The reason
Yes.
behind that is the hormones, actually. So our, we have a special sweat glands present there into this particular part. And like we have a axilla, in axilla also we have a different sweat glands are present. So whenever female is going for puberty time period and in our reproductive time, when follicular stimulating hormones are coming, when the glomerular GnRH hormones are coming, when our internal organs, ovaries are developing, so those development of the ovaries and those special hormones into the reproductive life, they have a special effect onto these apocrine glands. That makes these glands more secretive. So more secretions are coming out. So it's not only the sweating glands, it's the apocrine gland which is present into this region. And those apocrine glands are going to create, give us lot of good structures down there, because this is a part of secondary sexual organs. So it's not this it's not like a simple skin. It is a special organ, secondary sexual organ. And behind this sexual organ, special apocrine glands are present. And those glands, it is their responsibility to provide a different type of secretions. And those secretions are going to create a good quality of hair into that particular region. And curly hair and thicker hair. So that secretion is the responsible factor behind that, and the hormones are responsible factors behind that. And till the time we will have those kind of reproductive hormones in our life, till the time we'll have this periods going on, and the quality of hair will be always good. And after the menopause, you can always see the quality will diminish, because the hormones, reproductive hormones, will go. And this, you can also see the change into the mons of a female when she is sexually active. So whenever we are sexually active, now glands are getting a lot of blood supply. They are more active glands. They will keep a lot of secretion also again at that time. So we can see a different type of mons, different type of shine in our hair, more secretion inside this area. So that's how we have a special and good quality of hair present into this because of the apocrine glands and because of this reproductive hormones. So
Thank you.
Okay, thank you so much.
Ma'am,
Yes, please ask.
ma'am, as you mentioned about the vaginal steaming, how can that be done?
Yeah, I'll explain you in upcoming slide. Okay, how to do. Yeah.
Okay, ma'am.
Ma'am, any age relationship with the pubic arc, the angle, any age relationship
with the pubic,
like
with the pubic hair with the pubic arch?
Pubic arch.
Pubic arch.
Any age relationship?
Yes.
Or is the same for both pediatric and adolescent and elderly?
So
the
what?
Pubic arch, the angle.
Angle. So you're talking about this backstage, if you wanna go there. So what is it like? Why we have to check the pubic angle? This is what you're asking. What is the
Yes.
Yes, I think there you missed that particular part. What happens if the pubic arch is narrow, 60 to 70 degree in female? We are talking about the female body. If the pubic arch is narrow, it means that ischial tuberosities are more closer, and that can create a closing of the downward area. So they might have a tight pelvic floor. Okay. Or
I mean in female, any age relationship.
Yeah, in female, it is a relationship, isn't it? Because if it will be the arch will be narrow, so that is going to bring the ischial tuberosity together. And if the ischial tuberosity will be together, that is going to put a stress over the SI joint. So they will do the loosening, they will strain the SI joint. Female will have more back pain issue and more pelvic floor tightness here. Ascending pelvic floor will be there. And if ascending pelvic floor will be there, that is going to create a sphincters closing, tightening around the sphincters. So female might have the difficulty in passing the stool, urine, or might be going inside the vagina because of the tightness of the pelvic floor. And if the arch is more wider, ischial tuberosity will be away from each other. So that is going to create weakness or descended pelvic floor. And if the descending pelvic floor means the support around the canals will be less because of the laxity of the pelvic floor, and the female can show you leakage issues, pelvic organ prolapse or laxity issues, hypotonous pelvic floor issues, weak pelvic floor. The fibers of the pelvic floor will be large, lax fibers. Okay.
Thank you.
Thank you, dear. I hope I answered your question, or you were asking something else. You can still ask me. Did I understood your question, dear? Yep. Did I answer you?
Yes.
Okay. All right. So that was a mons pubis, and that is the important part about the pubic hair. Look, girls, we will never give the guidelines if the female is not asking any symptoms. If she's showing you something on the vulva, if you can see the boils, you can see the dry skin, if you can see the pustules present, if she's asking you, then definitely we have to guide them. This is our responsibility. If they're not asking, then it is up to you. Okay. After this mons pubis, we have another thing which is going on, that is the labia minora. Another skin fold is present. So that was a mons pubis which we discussed. This was a mons pubis, green one. Now we have another part which is extended on the sides, flap of the skin. These two flaps which is going on either side. So these two flaps which we can hold between our index finger and the thumb also. So you can hold it. It's like a lips, like we have a lips on our face. You can hold those lips between your hands, finger and your thumb. You can lift it. So we called them labia majora. So this is the thigh, and then this folds present. So when the female is in standing position, if you just stand, and you can see that the flaps are closed, and then you can open it. The skin folds, you can widening that also. So this is the labia majora. Majora, we are calling it. And majoras, so there are two majora, right and left. Outer fold of hair-bearing skin and fatty tissue, which extends from the mons to the vestibule downwards, around the perineal body. So we have this perineal body downwards. So all the way from mons to the perineal body down there, we have this labia majora, two skin folds present. And into this skin fold, we have a continuous presence of pubic hair. So pubic hair was present on the mons also. Same way pubic hair is present on the labia majora also. So hair-bearing skin it is. It is gonna act as a padding to sensitive part of the inner vulva. I always assume that this is a door, outside door. So if you see the female like this, as she's standing in front of you, you cannot see anything inside. Everything is closed. So her sensitive part, this inner sensitive part, clitoris, vestibule, her labia minora, her urethral opening, everything is secure inside. And they are the protective doors outside. So protective door skin, we can say. It is act as padding to the sensitive part of inner vulva. It also has the glands. Now, when we're talking about, it has the same surface or same structure which present into the mons. So mons was having a fatty tissue, it is also having a fatty tissue. Mons was having the apocrine glands, it is also having apocrine glands. And mons were having a hair, it is also having a hair. It means the hair follicles will also be present here. So if you remove the hair from this area, so that can also, you can see that, you can note down the pustules and dryness into this area also. So this is the same skin which is present in the mons, but they are two folds, and these two folds we are calling it as a labia majora. They act as a padding. It also has a glands which provides oil to keep surface moisture, like the vulva, like the mons. It has a special skin cells, basal cells. Yes, that is important to understand. These basal cells, because in our whole body we have a different type of skins. It can be epithelial skin, there can be basal skin, there can be different types of skin. Out of this, the epithelial skin is a very softer skin, and that present inside our canals. Okay, so very, very sensitive to touch, this epithelial skin. So, but the basal skin is a tougher skin. It is not as sensitive. It is very tough skin. So this basal skin is present into the labia majora because it is between the thighs, and it is keep touching the thigh area. Or whenever we are wearing something, or if we are sitting, or if we are wearing our pants, all the things are touching that particular outside area. So that skin is a hard skin. Like we have a hard skin, this around this elbow. So same hard skin kind of basal skins are present into the labia majora also. And those basal cells also has a special quality that they keep producing keratin, and keratin makes the skin more tough skin, and that also gives a color, different darkish color to the area. You might have seen that some females are curious, or they have always this kind of worrying going on that my skin is dark, how I can whiten my skin. So they do bleaching, they use lot of different things to create a whitening into the skin. But this is a skin, you be born up with the basal skins down there. We cannot lighten the area, the part, and we should not even try to do that. Don't apply the chemicals around that area. Otherwise, you're going to irritate the skin. We can never change the color, whatever color we born up with. So we should respect the area and don't do that. The special skin cells, basal, which produce keratin that serves as a waterproofing and makes the cells more tougher. Waterproofing means whatever moisture is coming from the area, that moisture will keep staying inside. So we will have a lubrication, and it is going to make our cells more tougher, and it provides protection against the injury, trauma, infection, as well as they trap moisture, whatever moisture is given by the glands. A special quality of this skin is it is that new layer of cells develop every 30 days, as every day wear and tearing happens with the friction. So very good special quality of the skin we are having, protective skin, and that skin is going to protect our more inner structures. So it's something like I have this mouth, these lips, and the lips are soft. I can understand they're soft, but these lips are gonna support my inner part. So inner part is having a different cells, outer part is having a different cells. Same way our labia is having a different cells, and that is going to protect our inner soft vestibule, which has an epithelial layers present. Okay, so they are a door, protective door for our body, which protect us, and they trap the moisture also. Again, we should understand that plucking the hair can irritate and show you the balls and pustules. So if you are doing the waxing, don't forget to have steaming. After your waxing, every day for 2 to 3 days, do steaming with steaming up to with the 60 Celsius water temperature. The same temperature you are using on your face, you can boil the water and take the steaming, and the steaming will help in unblocking the pores and make your glands more active by improving the blood supply. When we are talking about the labia majora and these two flaps, those two flaps are like two sisters, okay? So right and left. So two sisters, we can say them. But those two sisters can or cannot be identical. They might be one, both are identical. They might be one is shorter, one is larger. Asymmetry can be present into this. So they are not twins. They are two flaps, but not twins, not identical. So every female can show you different structures. It's like we have a different lips. It can be same lip. It can be one big, one small. So the same way we can have a different lips down there also. After, once you remove, so now once you just separate apart the labia majora, assume that you are just separating them with your fingers on the sides, you will see another wall inside, and that wall, we are got two walls, right and left walls, and that is labia minora. We call it as a labia minora. So that labia minora in this say, look, and that labia minora can also be of many different size and shapes. Altogether, 60 to 80 different types of labia minora can be seen in different females. Okay, so different walls can be there. You can say that the wall, labia minora wall can be, look, this is two walls. So these are the identical walls, same walls. So again, two sisters, okay? So same symmetrical wall. There might be the walls are wider on the top around the urethral part and narrow at the bottom around the vaginal area. Okay, so the flaps can be like this, enlarged labia. Like this is, you can see, is enlarged labia. One flap is wider on the top, and then other flap is narrow on the sides and very narrow, and the bottom end is coming more narrow. So two flaps can be different, and you can see this is more bigger, wider length, width is more of the labia minora. You can see in this one that width is more and but shorter labia minora when the vestibule is visible. As soon as female will be given the crookline position with the hip abduction, you can see the labia majora will open and the labia minora will be seen, and that might be also open. And vestibular part, inner part of the vulva of this area is visible. And in this inner part, vaginal opening, urethral opening are present. So vestibule is visible. So that can also be present in some females. Like in this structure, you can say the labia majora is present and you cannot see any vestibule part, but here you can see vestibular part. These openings are present. Here also you cannot see the inner vestibular part, but you can see the inner wall of the labia minora. Okay. In this one, you cannot see inner wall of the labia minora. That is completely closed. There's no visibility of vestibule also. It is completely closed, very protective structure. But the labia minora is narrow from the top and that flap is touching each other and it is wider from the bottom around the vagina. So that kind of dancing, we call it as a dancing labia minora, can be also seen. And in this also, you can see, you can appreciate the labia majora is also closed and the labia minora is also closed. In this one, it is open labia minora. And in this one, vestibule is visible. Here also vestibule is visible and very short, small labia minora is present. Okay, so this is a wall and different type of labia minora can be present. Now, labia minora is there are two small folds of skin located between labia majoras and they protect very, very sensitive part. Now, which sensitive part this labia minora is protecting? Now, if I'll create a labia minora for all of you, so if this is the female body and we are creating a labia minora on the side. So this labia minora is connecting from, and beneath that we will have a perineal body, then anal canal. You can see here, this is a penile body, this is anal canal, anal opening, this is a penile body, anal opening, this is a penile body. You can appreciate this is a penile body here going on and anal opening. So now this connection, when it is starting from the penile body level and it is going upward, one flap, right flap, they will go up and then left flap will come and that will also join with each other. So the connection, they are forming inferior connection, this particular connection. We are calling it as a posterior vaginal fossa. Okay, so that is the name of this skin. Posterior vaginal fossa. It is written somewhere, might be in upcoming slides. So we are calling it as a posterior part, downward part, posterior vaginal, beneath the vagina, fossa, F-O-U-R-C-H-E-T-T-E, vaginal fossa. Okay. And the flap will keep going up and the tissue which is present into the labia minora, they are not the basal skin. They are made up with the erectile tissue. It means that those skin goes for erection. So whenever we are sexually aroused, the labia minora has the erection. You can see the erectile because of the erectile tissue presence of the erectile tissues into this. And the upper connection over here, they will join with each other, and then again they will form a small skin fold. So this extension of the small skin fold, where our clitoris is present, glands of the clitoris is present here. So the glands of the clitoris is present within the clitoral hood, and that clitoral hood is the extension of labia minora. Are you clear? The same skin. It means whenever we will be sexually aroused, this labia minora as well as the clitoral hood, they will go for some kind of action because of this erectile tissue which is present here. Erection will happen, and because of erection, they will move backward. Okay, and they're going to create the openings because the erection. So assume that this. Okay, and then erection. So once they will erect, they will move away from each other, and we can see the open vestibule. And into the vestibule, you can see our openings, presence of the opening. And female will be ready for the penetration. We will understand that in our female sexual functioning webinars, but this is important to understand. Another thing is labia minora. They are two folds of skin located between the majora. They protect the inner vestibular region. So as I told you, the inner part which they are forming, now this inside part, inside this part, we are calling it as a vestibule. Okay, so vestibule is very, very sensitive. As I told you, it has epithelial cells, which is sensitive to touch. We should not even directly touch the vestibule area. Like, we are not touching our lips like this most often. Same way, we should not touch the vestibular area with our fingers or with our hands. Always try to touch the vestibule with some kind of cotton buds or some kind of earbuds which has this soft cotton present, and with the lubrication on it. Okay, no direct touch. Now, another part about the labia minora is they don't have fats. They're not fat cells. They have an erectile tissue. So if they don't have a fat cells, it means they don't have hair also. Okay. But beneath that, we have a presence of sebaceous gland because we really need lubrication into the area. So we don't have hair in labia minora. We don't have fat cells into the labia minora. But glands are present because we need moisture. Okay. More blood vessels. Lot of blood capillaries are present into this region, and that is gonna give different lightish pink color to our labia minora. So if you see, the labia majora will be darkish, but labia minora will be pinkish, purplish, and they will have that purplish and pinkish colors because of the blood capillaries which is coming here. So too much of blood supply is there, and whenever female aroused for sexual activity, because of lot of blood supply, the area goes for erection, and we can see lot of swelling kind of change around this edema kind of change around the labia minora. And this particular region will be more pinkish during the when the female is sexually aroused. And not only during the sexually aroused, whenever our female is pregnant, at that time also we understand that whole blood supply is going towards the reproductive system. And this particular area is present downward, inferior to the reproductive system, as they are the secondary sexual organs. So when the uterus is getting a lot of blood supply because baby growth is going on, so blood will be more blood will be flowing towards the pelvic region. So female will have lot of blood supply coming into the labia minora also. And at that time, we can always observe some kind of swollen vulva of a female or a swollen labia minora of a female. And that is what we are calling it as a Chadwick sign, actually, is present during pregnancy. Swollen vulva, okay? Swollen labia minora and majora, both because of too much of blood supply. And more pinkish and dark purplish color of the vulva. If you get a chance to see a vulva of a female, you can note it down. Another thing which makes this labia minora very, very sensitive is the nerve endings. So lot of nerve endings are present into the nerves of our whole body. They are ending into this region. So it means they are making it more sensitive to touch. So during our sexual sensation, sexual arousal, if you touch this area, once the erection is going on, second swelling is also going on, third more sensitive to touches it is also. So anything which is going to touch, if you will touch your fingers, if you lift the tissues, the skin flap, you will feel more sexual sensation whenever we are sexually sensitive. So during sexual arousal, one word, a sexual functioning, one word which we are calling it is a foreplay. So during foreplay, whenever we are touching the labia minora, there are always more sexual sensitive feeling the female will feel because of the presence of many millions of nerve ending into this region. Okay, when we are talking about as a crux, so I can we can say that erectile tissue, no fat cell, no hair, and a lot of nerve ending, too much of blood supply. So there are 5 things. No hair, very thin skin, very less keratin, make it more vulnerable to injury and infection. So if the female is keep having this kind of UTI problem and vaginal infections and this kind of infections going on down there, so there this labia minora will be always swollen, inflamed, and always kind of infected. And if there will be infection, so they are going to create the blocking of the pores into this region, and that can create a itchy, obstructive pores and itchiness into this region, and less like lubrication coming out from this region, from the beneath this skin pores, because endogland, the glands are present. So glands will keep secreting, but the skin will not be able to pass that secretion outside. So dryness, inflammation, those kind of things are very common to see in case of UTIs. Inflamed labia minora can be present. Okay. So I hope you are clear about labia minora. Is there any question about labia minora?
Ma'am,
Yes.
ma'am, you said that there is many types of abnormal or asymmetric labia as we can see in the slide. Ma'am, what all problems will a female face if there is if she does not have a normal labia during erection?
Okay. No, look, they don't have any significance that, it structures are, we can born up with different type of structure. So we can't say that it is abnormal labia minora. We should not term it as abnormal. We can term it as a different names like enlarged labia, irregular labia, dark color labia, asymmetrical labia. You can say like that. But the relationship is there that if the size of the, okay, let me ask you one question, simple question here. Out of this, let me name it. So there are altogether how many labia minoras you can see? 7, isn't it? So 7 labia minora. Okay. So tell me one thing. Out of this 1, 2, 3, 4, 5, 6, 7, which female is more prone to have infections? Which number?
Sorry, come again. Prone to having what?
Out of 7 labia minora, which labia minora is more prone to have infections, UTIs? More prone to have the bacterial infections, yeast infection out of all these 7?
6 and 2.
Which one?
6, 2, and 1.
6.
Okay, 1, 2, 6.
Again, I look at it again. Which is the most is going to give you lot of itching and infections, which is the most dangerous? No,
Ma'am,
dangerous.
6 and 1.
I think 6, 7, and 2, 6, and 7.
2, 7, and 6.
2, 6, and 7.
Isn't it? 2,
Okay.
6, and 7. Why? Any bacteria can directly go and infect
The
the.
labia minora is more often.
Yes, labia minora is more open, and we can see the visibility of vestibule. Anything bacteria can directly go to the vestibule and can infect the openings, urethral opening and vaginal opening, and infection can go into the urethra and vagina. So these kind of shape of the minoras are more prone to have UTIs. So if we saw those kind of structure, we have to tell our female to take care of maximum hygiene into this region, this area. Keep washing yourself with water, just a simple water after every urination. Make your areas more dry, like don't make it very wet all the time, because wetness is a source of bacterial infection. So we should have a good, that kind of clothing. So this female 2, 6, and 7, what type of clothing is not recommended for these females? Tight clothing,
Yes.
the panties, when they are wearing a panty, the size, the material of the panty, if it is a synthetic panty they are touching, so they are not wearing the cotton. So cotton, what the cotton will do, cotton will absorb, because the secretion will come from the vagina, from the urethra, and the cotton material will absorb the secretion. But if they will wear the synthetic, they will not be able to absorb, and that is going to create a lot of wetness, and because of the wetness bacteria can start getting developed, and it will give kind of this kind of infections to it, can give UTIs to the patient and to the females. So you can always appreciate that more closer labia minora, not visible internal structure, is more safer structure female is having, and she will not be more prone to have UTIs. Clear, girls? The structures are fine.
Yes,
Doesn't
ma'am.
matter what kind of labia minora you are. According to those kind of labia minora, we have to guide them. What kind of clothing they have to do. There should be loose clothing, not unnecessarily tight clothing, tight jeans. So those females should not wear tight jeans. That can irritate the vestibule. And the thong, the panties, which they have the simple strip, so those panty they should avoid. Otherwise, the strip is gonna unnecessarily create a kind of irritation with the vestibule. They're gonna touch the sensitive tissues. And the female who are having 5 and 4 and 5, so 4 and 5 is more safer vestibule, a safer vulva of a patient, of a female, where the chances of infection will be very minimal. Okay. So what we can do in those cases, whenever your female is having a short, this kind of open structure, open vestibule, we have to give them awareness and education that your structures are like, we cannot increase the structures. We cannot make the flaps big. Like it's the flaps they are born up with. It's the lips they are born up with, the smaller lips they are having. But yes, those female don't use any chemicals, direct perfumes, any sprays, any whitening chemicals, because the whitening chemicals can directly go around the vestibule. They can irritate the vestibule. Don't apply soap around this region. Some people, they are using that vaginal wash and they are using this vulvar wash. So don't use those kind of washes. Just a simple water wash is important, because our body is made up in the way that water is okay, is good for us, and our organs are self-cleansing organ. So don't apply any chemical, any soap, and use loose clothing and not a tight clothing, and avoid direct touching with the surface, like bicycle riding. This kind of female has to avoid bicycle riding, prolonged bicycle riding, or prolonged those kind of sitting where they're touching this area is touched by something. Don't wear the thongs, and keep yourself kind of not very, very wet. It should be wash yourself and pet dry after every wash. And keep changing your panty, cotton panty, and keep changing your panty after every 6 to 7 hours. Whenever you feel that you have a wetness, change your panty. Sometimes we are outside, we cannot use panty, we cannot change panty frequently. When we are at our job, we are outside our house, we are leaving the house in the morning and we are coming back in the evening. So those female, we should have advise them to use panty liners. So use a panty liner and keep throwing the panty liners. Don't make the panty liners wet. As soon as you feel that your panty liner is wet, you throw the panty liner and use the different new panty liner. So keep extra care to your structure and prevent yourself from unnecessarily those kind of bacterial development in the area, and use loose pants where the air circulation can keep going on. Clear, girls? So this is a vulvar care which we have to teach them. Yep. Dr. Rohini is asking, maintain pH level of, can we use tone? Okay, let me go through the question.
Okay, ma.
Did you say vaginal steaming? Yes, dear. I said vulvar or vaginal steaming. Yes. How can we do vaginal steaming? I will explain you in upcoming slide. We have a slide for that. Ma'am, what all problem will a female face if she doesn't have normal labia during erection? It's okay, dear. We have a different organ for our sexual activities. It's a labia minora is just a one part. It's a part of secondary sexual organ. It's not a primary sexual organ. We have our primary sexual organ. Yes, yes. Can we increase tone of this area? Yes, definitely. We can always increase tone of this area by eating a good food. Always eat food which has a high collagen and which is high in probiotics. So that food is good for that, and try to do those activity which increase the blood supply to that region. So exercises like pelvic breathing, legs on the wall. So they all these exercises where we can lower abdominal workout, plank workout. So they always good to bring a good amount of blood into the region, and we can always help them in creating the good vascularity. Whenever we are talking about the tone is depending upon the hormones. The good hormones your body will secrete, the more estrogen will be there, the better tone will be there. So try to always have a good periods. So your period cycle should be normal. So the female who have a normal period cycle, they have a good tone into this region. Dr. Rohini Vijay is asking, maintain pH level of vagina. Dr. Rohini, I will ask you this question when we'll discuss about vagina, because we are still not discussing about that vagina. So we are still on the vulva. So it's a part of vulva. I'll definitely answer you this question. Okay, any other question is there? The darkness of this area is not normal. The darkness of this area is normal, dear. Or you're asking the labia minora. You compare your labia minora skin with labia majora skin, and when you will compare both of them, you will find your labia minora will be more purplish into color, purplish or pinkish or reddish. But your that skin tone will be different. Labia minora will be different, darkish, but this will be purplish, and that is going to give you that understanding that they have a good blood supply going on. I'm just going through the questions. If there is something is left. Okay. Hi girls. So all of you are now done with it? Labia minora, you understood? Yes?
Yes, yes.
Good.
Yes.
When we're talking about the length and the size of labia majora, everybody is having a different length and size. The size can be anything between 0.4 to 6.4 centimeter into length. So everyone can show you the different size and different width. So nothing is normal. Everyone can have a different lips. So it's all right. You have to just take extra care. As soon as you will open your labia minora, in this image, it's beautiful. You can see this is the inner layer, inner wall of the labia minora. And this is the inner wall of the labia minora. And this inner wall is creating another opening, extension of the skin. We are calling it as a clitoral hood. And into the clitoral hood, it's again a skin flap. It means erection is going to happen, blood supply is going to be high, nerve endings will be high into that skin. So in each image, you can see we are having some kind of Look this here, it is visible here. This kind of skin flap, this kind of small skin flap. So every one of you, please observe your labia majora, labia minora, and your clitoral hood today, so you can appreciate those structures. Into this clitoral hood, we are having this clitoral glands present. And beneath that, if you open up these are the two walls, right and left wall. Just inside the wall, you can see a very, very soft pinkish color structure. This particular part we are calling as a vestibule. So this part is vestibule. This is vestibule. This is vestibule. The light pinkish part around the this whole area. In this vestibule, throughout this length, if this is the length of the vestibule around 100%, okay, out of this 100%, upper 25%, we will have a presence of urethra. Urethral opening will be present here, urethral opening, and through which we are urinating always. And beneath that, we will have this downward 25%, we will have the labia, we will have the vaginal opening. So opening of two canals. So now you can appreciate the two organs were present, bladder with urethra, which was passing through the pelvic floor. And then there was another organ that was uterus with the vaginal canal. So vaginal external, so this is the vaginal canal, this is a urethral canal, and this is the vaginal canal. So you can see this canal and this canal, external opening. This is internal opening here of the urethra. This is the internal opening of the vagina. So same way, you can see this external opening of the vagina visible here. And this external opening of the urethra is visible here. So both openings are present into vestibular area. So this is the vestibule of a female. So let me raise and explain you about the vestibule through my slides. Vestibule, it is protected by labia minora fold. Yes, you understand that? It is very sensitive and smooth to touch. It has a similar mucosal skin cells which present inside the vagina. It means epithelial cell layer is present here because epithelial cell layer is present inside the vagina. It is very, very sensitive to touch. And into this particular vestibule, we have urethral opening and vaginal opening present. And through another two things are also present on both sides, and they are the opening of the glands. So beneath the labia minora, if you open the skin, for example, this is all this complete whole skin, this whole tissue. If you just remove the tissue, beneath the tissue, we have two glands. Big glands are present, and we are calling them glands of vestibule. So just this is the skin of, look, this is the clitoral hood, and we are having clitoris, and this is in the inner wall of the labia minora, and this part is the vestibular area. I'm forming the vestibular area. And beneath the vestibular area, upper part here, we have a big glands, and we are calling it as the gland of vestibule, the skin. So you remove the skin, and behind this, there will be a gland of vestibule. And there's another gland you can see. This is the Bartholin gland. This one is the Bartholin gland on the bottom of the vagina, which is beneath the what is this? A gland of vestibule. Just beneath this, we have a Bartholin gland. So two glands are present behind this skin, which we are having, labia majora and minora. So you assume that we are removing that. So as soon as you remove the skin, then these glands will be present. So these glands means they have to produce some kind of liquid, and that liquid has to come out. So the liquid is having, these glands are having two openings. So this is one opening from this big gland, which is present both sides of the urethra. So this was the urethra, and both sides of the urethra, we are having this opening. Same way, we are also having the glands open both sides of the vagina. So both of the vagina, we have a Bartholin gland, and they have an opening of this Bartholin gland. Let me erase and again show you. So these are the two openings of the gland vestibular gland, and we are calling them the opening of Skinner's glands. Same way, this is the opening of the Bartholin gland. Now, these openings, where to palpate, where to see in our female body. So, this opening will be palpable. Assume that we are having a clock. So, this is a 12, 1, 2, 3, 4, 5, 6, 7, 8, 12. So, assume that you are putting this clock over the orifice. So, this is a vaginal orifice. We are putting the clock here. So, into this clock, this will be 12, this will be 6, this will be 3, this will be 9. So you can appreciate 4 o'clock and 8 o'clock of urethra, the opening of Skinner's gland is present. Same way, if you put this clock, we call it as a pelvic clock. Okay, so this is the pelvic clock. Pelvic clock. So if you put the clock over the vagina, same way we can see 3 o'clock and 8 o'clock, we have a opening of Bartholin glands. So all together into the vestibular region, how many structures are present? Vaginal opening with 2 paraurethral glands. And sorry, urethral opening with 2 paraurethral glands or Skinner's gland, or vaginal opening with 2 Bartholin glands. So altogether 4 structures are present, 6 structure actually. 2 Bartholin glands and 2 Skinner's gland. 1 urethral opening and 1 vaginal opening. All of you are clear? You might have heard
Yes, ma'am.
this word, the Bartholin cyst. Sometimes, this gland, this is blocked because of the pathogen or some unwanted outside, any bacteria or any infection. So there might be blocking of this pore, and when the block will be there into the gland, so this gland is secreting, and the liquid cannot come outside, and the gland is going to keep accumulating, keep getting kind of swelling, because they will keep secreting the liquid, but liquid cannot come outside because the opening is blocked. So when the opening is blocked, that is going to create the cyst formation inside, and we call it as a Bartholin cyst. So what is the treatment for Bartholin cyst? What can be the treatment? Opening of the gland. So how to open the glands? What things can create the opening? Steaming. Steaming can open the skin pores? Yeah. Steam can open the skin pores, girls.
Yes.
Yes. So steaming is very, very effective for all of us. So whenever we have a low lubrication going on, or less liquid is going on, or we have a dryness, we feel dryness into this region. So it's always like, keep increasing your blood supply and kind of opening this steaming, the moisture. Sometimes the moisture is blocked, the glands are blocked. There's the small minute glands, and they might get unnecessarily obstructed by some kind of outside, bacteria or small things. They can create obstructions. So steaming can always help in opening up of the gland. So very, very effective it is. So this is vestibule. All right, girls. So how the session is going on? Is there any questions so far? Or you have
All right, Dr. Sunita, I want you to throw more lights on the openings around the Bartholin glands and the skinny glands, please.
you want
The
me
one around urethra.
okay, you want me to revise that?
Yes, I didn't get it very well.
Okay. Let you understand the vestibule. Okay, so the vestibule is a surface area which is inside the labia minora. Into this vestibule, if you divide the vestibule into like, for example, 100%, like this length, so that okay, for example, this is a vestibule, this much is the vestibule all the way downward. Okay, so we have this vaginal fossa present here, the skin. Now upper part, upper 25%, we have a opening of the
Urethra.
and lower we have a opening of the vagina. Yeah, clear? Now assume that we have a clock, and you assume the clock over the urethra. So in this clock, 3 o'clock and 3 o'clock, and this is 9 o'clock. So now as
Okay.
this is a 4 o'clock. Look here, it's 4. And this is a 8 on the other side, right side 8 and left side 4. So if you palpate very softly that structure, that sides of vestibule with the earbud. So take a earbud and put the earbud in a gel, some kind of oil, dip that in a gel or oil, and very softly you do the strokes around 4 o'clock and 8 o'clock of urethra. You will find small openings. Okay, very small opening, minute openings. So these openings are the openings of the gland which is present beneath that. So which gland is present beneath that? Bulb of vestibule. So that is a big gland, sponge-like tissue. So they will secrete a liquid, and that liquid will keep coming out from this particular glands. We are telling the name of this gland as a paraurethral gland, because both sides of this urethra, paraurethral. So we can also name it as a paraurethral gland, or we can also name it as a opening of the Skene's gland. So it's because beneath that is this bulb of vestibule is present. Okay, so the name is the opening of Skene's gland or opening of the paraurethral gland.
Okay.
Very down, we are having another small gland present. That is the Bartholin gland, and Bartholin glands are also opening both sides of the vagina, 4 o'clock and 8 o'clock. Now, what is the function of these particular glands? Why and when they become functional? So let's talk about the first one, paraurethral gland. So what happens actually whenever a female goes for urination? So once the urine will come here, so what is going to happen during the voiding of urine, passing of the urine? The urethra is going to enlarge, isn't it? It will enlarge into size. It will open up. Once it will open up, it is going to put pressure over this sides of that. Now, this particular gland, they are already having some kind of liquid and some kind of secretion. So once the urethra will expand, that expansion of the urethra is going to put compression on this gland and on these openings, and they will get compressed, and whatever liquid is they are storing, the liquid will come outside. And that liquid is going to create a lubrication around the urethra whenever we are urinating. And if we'll urinate, before urination, once this urethra was getting prepared by expanding, already the secretion is outside, and this secretion will provide a moisture. They will create a moisture, and once our vestibular structure around the urethra will be moisturized already, and then will pass the urine. Urine is acidic into nature. Assume that these Skene's glands are blocked. So if they will be blocked, so no lubrication will come outside, and this tissue is gonna have this acidic urine touch, and that might irritate the skin, and female can have an irritation and burning sensation. You understood? So we really need opening of these glands whenever, and their glands are active. As soon as the female will finish the urination, the urethra will be closed, it will be compressed, and again this gland will acquire liquid from the underneath. This openings will have this passage will have a liquid from the underneath gland. They will again fill it. So this is the whole day. Whenever we are going for urination, the glands will keep helping us by providing the lubrication around the urethra, and female will not feel dryness. Same is going to happen during the vagina. Whenever we want to insert something inside the vagina, and vagina will expand. So expansion of the vagina is going to put pressure over these glands, and this is not only this structure, only the vagina, even we have a pelvic floor muscles are also present. So pelvic floor will also contract, they will go for closing, tightening, they will compress the glands. So once they will compress the glands, the liquid will come outside. And once the liquid will come outside, so we will have the lubrication around the vagina. So before the penetration, before touching the vagina, we will have a moisture vagina. You might have seen whenever we are sexually aroused and whenever we are doing the foreplay, so there's a lot of lubrication is going on into this region. That lubrication is coming from the vagina, and that lubrication is also coming from these glands, Skene's gland, Bartholin glands, okay, and they are going to give us a lot of lubrication. And these glands, bulb of vestibule and this Skene's gland, they are squeezed between our pelvic floor muscles. So our pelvic floor muscles are present in two layers, superficial layer, middle layer, and the deeper layer. There are three layers with one after another. So now these glands are present between the superficial layer and the middle layer. So assume between my two hands, the glands is squeezed. So my phone is gland. So whenever the pelvic floor will contract, they will squeeze the gland. When they will be squeezed on the gland, the lubrication will come outside. So during sexual arousal, we are sexually aroused. So our body is developing myotonia. So our pelvic floor is also getting that kind of tension, and that is going to create a squeezing onto these glands. Glands are like sponge. They are holding a liquid. When you compress them, the liquid will come outside and the female will feel lubrication, and we are ready for penetration and we are ready for touch. I hope I cleared your answer.
Yes, ma'am.
Okay.
Sorry, there's something I want to add. Although it might sound awkward, but sometimes someone might ask you that, I noticed this, that that is when having sex, some women tend to urinate. So what you've just explained now, is that the phenomenon behind it?
Yes. Actually, what happens, there's another reason behind that. Some females, that whenever they are having a sexual intercourse, they urinate. So what it is a coital incontinence. So those we know this term as a coitus incontinence. Coitus activities, they have a leakage. So what happens whenever the penis will go inside the vagina? Assume that penis will enter inside the vagina. So that penis is big into diameter. So that will put pressure over the urethra. Okay.
Okay.
So let me show you through this image actually. Yes, this image. So if this is a vagina and if assume the penis will go. So as soon as the big diameter of the penis will enter inside the vagina, that will put pressure over the posterior wall of the bladder. That will push the bladder anteriorly, isn't it?
Okay.
That's going to make
Yeah.
a space. So once it will push anteriorly, the liquid, the urine which is coming into the bladder, the urine will come down into the urethra here. And at that time, the patient female is having a weak pelvic floor. Urethra is, we have sphincters all around the urethra, external urethral sphincter. So that they are made up with the pelvic floor. So the female, she don't have a strong pelvic floor and strong sphincters. So she will leak because this pressure of the penis will put stress over the bladder. And during that, urine will come outside. Some amount of urine will come outside. So this is a part of type of stress incontinence. This coitus. So during coitus activity, penis is putting stress. And because of the stress, she's leaking. Okay, clear?
All right. Yes, ma'am.
All right. So shall we have a break of 5 minutes or 10 minutes and then we'll see each other again?
Mom, I have a question.
Please ask.
Mom, can these two glands be impaired? And if it is impaired, what will be the possible symptoms for the impairment of this gland, those two glands?
Yeah. So in this image, can you see the visibility of the gland? One is this gland, which is present, and they have opening, and other is this gland, which is present. This is the gland which I was talking about. And they're calling, so that if the gland is like, sometimes the gland function is depending upon the hormones, not sometimes, always. So glands are active whenever estrogen hormone is there. Okay, so starting from the menarche all the way up to the menopause, the gland should be active because we are having eggs. We are going to develop the egg every month. We are going to have this estrogen in our body. So these glands will be more functional under the effect of the estrogen. More estrogen will be there. More functional glands will be there in our body. So whenever the estrogen effect will be less, the glands will not produce a lot of liquid. So once they will not produce a lot of liquid, they cannot secrete liquid outside. So after menopause, there might be atrophical changes happening to the gland that can affect the dryness, itching, those kind of sensations down there because of the lack of the estrogen. Another problem which can happen here, sometimes the glands are functional, but the passage is blocked. When the passage will be blocked, glands can start creating swelling inside. They will be swollen gland. And if they will be swollen gland, they are going to put pressure over the nerves, which is coming into around very near to this area. So the nerve will be a kind of stretch, and they are going to send the signal to the brain that we have a pain into this region. So we call it as a vulvodynia. So female can have a vulvodynia because of the it can be because of any issue. Vulvodynia can be because of any issue, but that can be one reason why the female is having vulvodynia, pain into the vulva, pain into the labia majora and beneath the skin because of the swollen glands. Because of this, the inflamed glands, because they don't have openings and inflammation is going on inside. And sometimes if the female is having infection going on into the vestibule, that infection can spread the UTIs, for example, or vaginal infections. So those UTI, those infection and bacteria and this kind of the pathogens, they can affect this particular glands. So that infection can spread to these openings. So through the openings, the infection can go towards the glands, and they can have like you can say vestibulitis. So that is another problem with inflammation of the vestibule because of the bacteria or yeast infections. Or that can cause the swelling of the glands also, or burning sensation, pain around the vulva. So it will be not only the vestibulitis, even the vulvodynia, both into the picture. Vulvovestibulitis, we call it as a vulvovestibulitis. Or sometimes it can be the Bartholin gland which can get affect, or can be both glands can get affect. So according to that, pain, burning, and vulvovestibulitis, vulvodynia, low secretion, they all can come into picture. Okay, dear?
Thank you, ma'am.
Thank you, dear. I hope you are clear about your Dr. Rohini is asking, ma'am, UTI anywhere related to these glands where burning micturition happens? Yes, dear. Sometimes this UTI, urinary infection, urinary tract infection. When we're talking about the urinary tract infection, it means urethra is got inflamed and infected. If urethra is getting infected, so the nearby structure will also get infected. So vestibule will be get infected. These glands will also get infected. So they will everything which is going to create the burning. Okay, Dr. Rohini? Someone is asking, Ma, is squatting an abnormality? Or first you have to understand what is squatting actually. Squatting is the release of the liquid at the end of orgasm. Whenever female is having the orgasm, she releases lot of fluid or some kind of liquid at the end of orgasm, and that liquid is kind of we can sense that liquid is more, and like more wetness we can feel around this region at the end of orgasm. This liquid or this feeling of release of the liquid is the squirting. What happens during orgasm? During orgasm, our body goes under the effect of complete squeezing, because your bulbocavernosus, our pelvic floor muscles, they are creating a squeezing effect onto the glands. They are tight. And even our internal pelvic organs, they are also going for this kind of, they develop some kind of tension. They develop cramping, the uterus develop kind of cramps at that time. So when we understand, you have to understand female sexual functioning for that. So how our uterus is working, how our vagina is working, how the internal reflexes are working. But on a short note, I can tell you that during the orgasm, whole body goes under the squeezing effect. So whenever this squeezing happens, they squeeze the glands. So whenever they squeeze the glands, so they are going to squeeze all the glands, even the vestibule, this Bartholin gland also, and they will squeeze that vestibular gland also. So whenever this squeeze will happen, these two glands as well as the squeeze will happen on the urethra also, because you can understand the urethra is present anteriorly to the vagina. So if every area is getting squeezed, urethra will also get squeezed. So that is gone. Urethra is also having urine, some kind of liquid, and that liquid is urine. So whenever this squeeze is going on, we can have release of this liquid coming from this cervix, because cervix is. Please mute yourself. So the squeeze, so this is a vagina. So vagina is going to get squeezed. So from where, which direction is going to get squeezed? Uterus will create a squeezing over the cervix. So cervix is also having lot of liquid, lot of gland. So all the glands which is present into the cervix, they will be squeezed. And then they're going to release some liquid. Vagina itself has a lubrication. Vagina is also going to release lot of droplets. So that liquid will also come outside. And then this vagina is going to put squeezing, because uterus, this penis is inside. That is also going to put pressure over the urethra or the bladder. So urine will also come outside. Bartholin gland will also get squeezed. Parietal gland will also get squeezed. So all the glands present inside the cervix, over the vulva, Bartholin and vestibule, as well as the vagina will be squeezed and the urethra will be squeezed. They all have liquid. Everything will come outside as a collective fluid. And this collective fluid is more into quantity, like might be half spoon, and not half, it's like 2 ml to 5 ml, that much of the liquid can come outside. So the liquid is collection of urine. So urine is also there, vaginal fluid is also there, cervical fluid is also there, and the liquid is coming from the glands, that is also coming there. So this is what we are calling as a squirting, and squirting is completely normal. There should be squirting, because that orgasm is going on, and orgasm is gonna create a it's a kind of tightening, kind of compression. It is a compressive effect on the glands. You are squeezing the glands. The muscles will squeeze the glands. As I told you, the superficial and middle layer, they have these glands. So they will go for a squeezing effect. So squatting is completely normal. There should, so it is visible. Clear, girl?
Okay, Ma, I thought it was the same question the previous participant was asking you, that some people do experience urination during sex. So I thought it was the same thing. Well, the answer I had you gave her was that if there is urination during sex, that is abnormal due to weakened pelvic floor muscle.
Yeah, that means it means more urination. Like, there should not be.
Okay, more than
that. Like if you are more than 5 ml, the squirting is there. So that means it is a urination.
Okay.
Okay.
So the volume of fluid produced during squirting is different from the one of the abnormal urination during sex.
Yes. That
okay.
Different female will feel the pressure over the bladder. She will feel that urine came out.
Okay.
That's
Thank you, Ma.
Thank you so much, dear. I hope your questions have been answered. And any other question into this vulva? Because we covered the vulva, mons pubis, labia majora, minora. These three parts are the vulva. And we also covered that vestibule. We also covered the glands. We also covered this and the small question answer session. If something else comes into your mind, please write down in the chat box. I'm going to take a break of 10 minutes. I'll see you after 10 minutes, everyone. Is it we are going slow or we are going fast? Or it is okay? You understood that?
Is it okay, ma'am?
Great. All right.
This Bartholin cyst is internally, you told that is internal. It can be external also?
Look, where actually where it is present, that Bartholin cyst, yeah, it can be an internal, because that is present inside. So this is a vagina, okay? This is a whole vagina. Assume that it's a whole vagina. And this is outside, we can see opening. Inside here is the Bartholin cyst, okay, over here. So that can be palpable outside also, and that can be palpable as soon as you enter inside the vagina on one side, lateral side, right or left. You found some kind of bulge, and once you press the bulge, it will be painful bulge to the female. Okay, and female might tell that the bulge is more whenever they are sexually active, because blood supply will be high, glands will be more active at that time, estrogen will be into the picture, testosterone will be into the picture, that will create more functioning of the glands. So at that time, more bulge will be, swelling kind of feeling female will feel. That can even do kind of painful intercourse. Female can experience that some kind of difficulty in penetration from that side. So that can be sometimes patient can tell me.
Actually, one of my patient has the same vaginal, the left side of the vagina, the exactly the Bartholin gland, and it is external cyst. It is not paining, but the cyst is there.
Yeah. So as you ask if
Looking like a water bubble.
water bubble is this, is the this Bartholin gland, which is kind of containing,
Yalla ba ana ta shirin aiki.
it is containing
Na ce ana ta shirin aiki.
sorry. Okay.
They're not in mute.
Okay, so you can understand that liquid is keep filling inside, and that is showing you the
Okay.
kind of big protrusion kind of structure. So the treatment of that is creating the small incision. Doctor will take us incision, drain out the extra fluid. Or another treatment is ask a patient to go for
Mm.
steaming. Steaming is also going to help her, or sits bath. Okay.
Okay. It's not paining actually.
It's okay, it's not paining, but then everything which is not normal is not normal, isn't it?
Yeah, the patient is 84 years.
Ah,
She's
okay.
complaining like a vaginal pulling pain.
Ah,
But just check this vagina, and I can express there is some cyst in the outside of the vagina, not it is completely external,
oh, and that is not paining.
not paining.
Okay, just
It is
no
and a
problem.
small cyst,
It's not
very small.
bothering. It is not bothering her. Leave it. Some females they have that. Or
Yes,
otherwise, ask her to go for this.
the
Uh,
cyst is not paining, but the vagina is a pulling kind of pain is there. Just maybe some prolapse is there.
no, if pulling type of pain is there, so it might be something else inside. Then you have to assess her limited ani muscles.
Then Stevie, the transvaginal ultrasound scan is better. Yeah.
It is.
But I can tell ma'am that the grade 2 prolapse is there for the cystocele.
So yeah, definitely it might be present. You have to go for transvaginal and look
Yes.
for the findings. Okay.
Thank you, ma'am.
Thank you, dear. Hi everyone. It's 10:22. I'll see you by 10:30 according to Indian time. So after
Okay.
minutes. All right. See ya. Have your drink something. Hi everyone. I'm sorry, I'm a bit late. I'm back.
Welcome.
Thank you. Okay.
Welcome, ma.
Thank you. So I hope everyone is here. Some people are still not here. Please put a message in the group to join them ASAP. Until the time I'm answering the questions. So it's written, which wash are good for vulva, hot or cold, lukewarm? Depending upon if you want to improve the blood supply, so then cold, hot is good. Sits bath with hot water. And if you have some kind of inflammation going on, then cold wash is good, or washing with the icy water. And otherwise, normal temperature is also good. Okay. Can hot wash are good during UTIs? No, the answer is no. Because during UTIs, inflammation is going on. So chilled wash, ice wash with the chilled water is good whenever you have a UTIs going on. All right, so okay, so now let's move and understand very, very, very important topic. Before going to the next slide, I want to ask you one question. Which one is which one is female sexual organ? Can you answer that?
Clitoris.
Clitoris? Yes, clitoris. Clitoris is our primary sexual organ. Yes. And what is the size of the clitoris? What is the size of clitoris, girls? P shape. Write down in the chat box. What is the size of clitoris? If clitoris is our, okay, so please answer the second one. What is the size of clitoris? And another question is, didn't get your response well. Hi, what kind of water should be used during UTIs? I'm sorry, Mariam. Did you got it? For UTI, urinary tract infection is going on, inflammation will be there. For inflammation, itching and burning will be there, okay? And pain will be also a sign because inflammation is going on. So for inflammation, wash with the chilled water, icy water will be always good. Yashika, I'll tell you about steaming. Don't worry, that is a rehab part. I'm gonna give you the rehab. The size of clitoris, icy water means chilled water. Put ice in the water and then wash yourself. Because ice or cryotherapy is gonna decrease the inflammation. Okay, Maria? Thank you, dear. Okay. Okay, so the answer of how big is the clitoris. So people are saying P shape, 1 to 2 centimeter or 5 to 7 centimeter. So yes, the answer is approximately 3 to 5 centimeter long clitoris it is. And the clitoris is not only the structure like a P shape, which is visible here. Clitoris is quite long into size. So we are gonna understand the clitoris in our upcoming slides. So this is the female external genitals, and into external genitals, this is a labia minora. On the top of labia minora, the clitoral hood of the clitoris, where the clitoris is lying. And if you just retract the hood, and during sexual arousal also, we can see the glands of the clitoris visible. And it is written here clitoris. So this is wrong, which is written. It should be the glands of clitoris, okay, not a clitoris. Clitoris is present inside of our body, and this is a glands, and the glands is going to have a body, and the body is going to go towards the pubic symphysis, over here, we can see that the body is going upwards towards the pubic symphysis, and this body is gonna attach with the pubic symphysis into the central part, connective tissue with the suspensory ligament. So this is one suspensory ligament. With the help of this suspensory ligament, the clitoris is held with the pubic connective tissue. So now this is the glans, body, and we have a legs of the clitoris. So over here, you can see the legs, which are very small. The legs are not like this. Legs are bigger than that. So this is a wrong image again. So the right image of the clitoris is this one. Let me show you. So clitoris legs. So these are the legs of clitoris. All the way they are going up to what? Ischial tuberosities on the side. So this is ischial tuberosity of a female. And you can also see the vaginal opening. So at the level of the vaginal opening, the legs of the clitoris are going up to that level. Approximately 3 to 5 centimeter long is the length of the leg of clitoris. So whenever female is aroused, the length can be more, because this whole clitoral structure is an erectile structure into nature. So as long, like if you understand the clitoris, clitoral is the female primary sexual organ. It has approximately 3 parts. It has 3 parts, not approximately, it has 3 parts. One is a glans, which is a very shiny part, which is visible outside. And that glans is hidden into the clitoral hood. And the second is the body of the clitoris. So this is the body of the clitoris. And the last is the crura of the clitoris, legs of the clitoris. So this is the legs of the clitoris. Another structure which is present here is the root of the clitoris. Root, this particular part around the neck. And from the root, you can see this, the big Bartholin glands are coming on the sides. So Bartholin gland is also a part of the clitoral network. So it is also sexually stimulated, sexually sensitive. So whenever we are touching on what is present on the top of the Bartholin gland, this vestibular gland, we know that this vestibular area, isn't it? They are present beneath that. So vestibular, this Bartholin glands is coming from that the clitoral root here, somewhere from here it is starting. So let me show you clitoris. So this is a clitoris of a female. What we assume that only this is the clitoris, the glands, like a pea shape, which is somewhere hidden, look like this. So it's only like this. It's even smaller than that. It's visible glands. It's not like that. This is quite big. This is whole body going up. We have a suspensory ligament. So this clitoris will be held into this area with the pubic symphysis here with the suspensory ligament, like this. Okay. And now some of the part of the clitoris you can palpate from the inside, from the vagina. And so this is like this. And this is curved, creating a curve. And now they are having these 2 legs. And from this body, the root. So this is a body and this is the root of the body. From this root, these are the Bartholin gland. And from this Bartholin gland, we have the opening which is coming around the urethra. Okay, so the liquid will be keep forming here and the liquid will keep coming outside. So this is the part of clitoral network completely. Clitoris, glands, body, root, legs, and Bartholin glands. Quite big structure, isn't it? And this structure is present all the way. Let me attach it. Look, all the way your ischial tuberosities. So our clitoris is not small, our sexual organ is not small. This is our sexual organ. And it is quite big and hidden inside. But most of us, we are not aware about this. Not only us, even the whole world was not aware about the clitoris. The world got to know about clitoris in late 90s actually. So that was quite late we discovered our sexual organ. And most of the people, they were assuming that vagina is a sexual organ. So everyone was thinking that vagina is a sexual organ, and because we are having penetration also inside the vagina, and or this penis is also going inside, and we are also hitting this orgasm. Some of the females, they are hitting orgasm inside the vagina, and the world was thinking that vagina is a sexual organ, but vagina is not a part of. It's not a complete sexual organ. We have a sexual sensation inside the vagina, but vagina is not sexually stimulating. So there is nothing which is making the vagina sexually sensitive. Nothing is there. So there is no nerve endings into the vagina throughout the length. So this is a vagina, and vagina is responsible for like kind of stretching. So we have this special tissues present inside, and we will discuss about vagina in tomorrow's session. But vagina don't have any nerves which give sexual sensation to the brain. But still the world was thinking that vagina is a sexual organ. And vagina, if you understood that, it is a part of reproductive system. So we, every month, we have this like endometrial wall is developing. We have a period going on. So blood will come by leaving the cervix. It will come out by leaving the vagina. So vagina is the passage. Like into bladder, we have a urethra. So same way with the uterus, we have a vagina. So it's a canal. And the responsibility of canal is passing the things outside, or bring pulling something inside, or collecting something from the outside world. So whenever penis comes inside the vagina, the function of the vagina is to collect the sperm, and move the sperm towards the uterus and for the fertilization. So female can get pregnant. So, but it is not sexually stimulation. There's nothing which is inside, which is making it more sexually sensitive. It's only 2-3 things about the vagina which is making it sexually sensitive. We will discuss that tomorrow. Like we have a pelvic floor muscle, we have a G-spot inside the vagina, or some nerve endings at the lower part. So we will discuss that, why we are having sensation inside the vagina. It's because of some, what is G-spot and everything. We will discuss it tomorrow. But vagina is not sexual organ. Believe me, if vagina would have been a sexual organ, so female would have been doing hitting orgasm when the baby is coming outside during the childbirth. So by childbirth process should be the orgasmic process for the female. But we never feel, or not never, we hardly feel orgasmic effect during the childbirth. Some females, they say that they have this orgasmic effect during the childbirth, not all. So 95% female, they never feel sexual sensation when they are giving the birth to the baby. So, but if vagina would have been the sexually sensitive, we would definitely have sensation when the baby is coming out. So, but there's no sensations, no nerves, which is making it sensitive. We'll discuss about that tomorrow. We'll understand the vaginal session tomorrow. Today we understood the vulvar session. And again, clitoris is a beautiful structure. Let me show, and this is our primary sexual organ. And we will still discuss about clitoris because it's a long topic, which is going to take approximately 45 minutes. So I don't want to finish that session in a hurry. So I'll cover that clitoris tomorrow. But still, I can make you understand that this is a male penis, this is the male glands, male body, and of the penis, this is their vestibular gland inside, and this is their legs. So our clitoris is homologous to male penis. Okay, you can see, compare both. Our clitoris is split into two parts, and why it has to split into two parts, this is what we will discuss tomorrow, more detailed about the clitoris. And this is what the organ I have already showed you, and it's a quite long organ. And yes, on the sides, this is a suspensory ligament. Sometimes female have a pain during the sexual arousal stage. It happens because of the tightness into this ligament. Once clitoris goes for the erection, all these things we will discuss tomorrow about the clitoris. Okay, girls. This is another picture. I'll show you everything tomorrow about clitoris. So I'm ending my session here, and we'll have a fresh start of this, because the detailed understanding of this organ is very, very important. When we are going to help a female for female sexual dysfunctions, low sensation, orgasmic issues, and everything, this organ is important. Okay, the masturbation, G-spot, whatever we have heard those terms. So this organ is important. How erection happens, everything. Okay, which muscles are on the top of it, which muscles are on the behind that. This is what we will discuss tomorrow. Dr. Sushma Shu, we will definitely discuss about the G-spot, G-point. Let's not G-point, it's a G-spot. We will discuss about tomorrow. Okay. Any questions so far? We finished vulva today. Vulva. We finished that vestibule and vulva. Okay. In vulva, clitoris is remaining, and I don't want to give it quickly finish. We will start that tomorrow. We'll learn it tomorrow. Yep. So shall I finish the session now? You must be tired also.
Very tired.
Oh.
Yes, ma'am.
Okay. So we'll go slow. Don't worry. Yeah. So yeah, because it's
Very
like
informative section. Yes, very informative section. Thank you so much.
so much.
Thank you, ma. It's highly informative.
Ah, thank you.
That is why we are not tired.
Ah, so sweet. We are not tired. That's sweet. Yeah, I know you are. You must. Some of you might be tired. Some of you might finding it very interesting. And but this clitoris is really interesting, and I really want to give you a start when we are going to start this session. So some videos are there which I will share, but not today. Tomorrow I will share the video with all of you. Okay, so today just vulva, keep in your mind, if you have any books, or if you can go and look for the vulva in like Google, YouTube, please find out more about vulva. Okay.
Okay.
Take care.
Thank you.
All the very best. Have a nice sleep.
Thank you.
And
Thank you.
Thank you, ma'am.
thank you so much.
Thank you. Good
Thank
night.
you.
Thank you.
Yes, good night, everyone.
Good night, everyone.
Thank you, ma. Good night.
Good night. Can you suggest any books for reference? Definitely, I'll share the PDF of the book at the end of the session. Okay, yeah, the girls, not now. You will get confused. Go through the webinars and then. Thank you. Thank you, Dr. Aule. Thank you. Bye.
Bye.